All right, let's dive into something that's deeply personal and, for way too many, incredibly frustrating: women's healthcare. We're going to take a look at this whole journey, from old school biases that have stuck around for centuries to the modern day fight to just be heard and empowered. So let's get into it.
Just look at this number for a second. It's staggering. More than half of all women feel like their pain is being brushed aside, often when they're at their most vulnerable. This isn't just a simple misunderstanding here and there. Nope, it points to a huge systemic problem that we call the gender pain gap. It's this phenomenon where women's pain is consistently treated less seriously than men's, and the consequences are, well, they're profound.
So that's the big question, right? Why? Why are women's symptoms so often downplayed or chalked up to something else? To really get the answer, we have to go back, way, way back.
Believe it or not, the roots of this problem are all tangled up in a diagnosis that literally haunted women for centuries: female hysteria. And even though it's not an official diagnosis anymore, it's cast this long, dark shadow that still touches modern medicine today. For hundreds and hundreds of years, hysteria was this catch-all diagnosis for pretty much any problem a woman could have. The definition was just ridiculously broad. And get this last part: a tendency to cause trouble for others. I mean, what does that even mean? It was basically a free pass to label any behavior that didn't fit the social norm as a medical condition.
And this wasn't just some brief fad, you know? The whole idea started way back in ancient Egypt with this concept of a wandering womb. And it just stuck around in different forms for almost 4,000 years. It was only in 1980, and let's be real, that's not ancient history, a lot of us were alive then, that it was finally officially removed as a mental disorder. That kind of legacy, it doesn't just disappear overnight.
When you look at this list, what's so wild is how normal these so-called symptoms are. Anxiety, irritability, not feeling hungry. I mean, these are common human experiences, right? But for women, they were all lumped together under this one dismissive label. It basically suggested the problem wasn't physical at all, but that it was all in their head. So, this old habit of chalking up women's physical symptoms to their emotions, it hasn't just vanished, it's evolved, and it's left behind a modern echo, what we now know as the gender pain gap.
And this isn't just a feeling people have, okay? It is a documented, researched reality. Study after study shows that women are consistently more likely to have their pain downplayed, misdiagnosed, or just plain undertreated. And that leads to huge delays in getting the right diagnosis and proper care.
This chart really shows you the real-world impact in stark numbers. So for something like an appendectomy, women got 25% less opioid medication than men. In the emergency room, for the exact same reported pain scores, women are less likely to get pain meds. And for IUD insertions, which many women find intensely painful, only about 30% of doctors even offer anesthesia. It's pretty shocking. These numbers, they represent real people and real suffering. So let's just look at one specific story, which started when a patient was only 15 years old.
You can see the huge disconnect right here. On the left, you've got a patient with a whole list of debilitating symptoms affecting her whole body. And on the right, the diagnoses she got were just bad periods and IBS. Her very real, severe pain was just normalized, written off as something less serious, without anyone digging deeper. 12 years. It took 12 years to being told her pain was just normal, or that it was something else, before she finally got the right diagnosis of endometriosis, and that was only after an emergency appendectomy. That's not just a delay, that's over a decade of someone's life spent in pain, confusion, and not being believed. So much of this dismissal comes from these really deep-seated myths and just plain misunderstandings about women's health. So you know what? Let's do some rapid-fire myth-busting and clear away some of that fog.
Okay, first up, the myth that infertility is a woman's problem. That's just flat out wrong. The reality is, the causes are split pretty much evenly. About a third are from male factors, a third from female factors, and the rest are a mix of both or just unknown. Next, menopausal hormone therapy. A lot of women are afraid it raises their risk of heart disease, and that fear mostly comes from one big study that was really widely misunderstood. But newer, better analyses show that for women who start the therapy in their 50s, it does not increase that risk. Now, this one is a really dangerous myth. The idea that you only have to worry about breast cancer if it runs in your family. While family history is a risk factor, the truth is most people who are diagnosed have no known family history of the disease at all. That's why regular screening is so crucial for everyone. And finally, the big one. The myth that heart disease is a man's disease. This could not be more wrong. The reality is actually tragic. Heart disease is the #1 killer of women in the United States. In fact, every single year, more women die from it than men.
So, when you're faced with this long history of bias and all these stubborn myths, how do you move forward? Well, the real power comes from shifting your mindset from being a passive patient to becoming an active advocate for your own health. Here are 4 simple, but honestly, super powerful steps you can take. First, document everything. Keep a journal of your symptoms. Data is really hard to dismiss. Second, ask questions. Challenge a diagnosis if it doesn't sit right with you. Ask, okay, but what else could this be? Third, and this is maybe the most important one, trust your gut. You know your body better than anyone on this planet. If something feels wrong, it probably is. And finally, don't ever hesitate to get a second or even a third opinion.
And all of this really brings us to the fundamental question at the heart of this entire issue. What changes when we, as a society, as a medical system, just start with the basic assumption that a woman's story about her own body is true? It's such a simple shift in perspective, but really it's one that could change absolutely everything.